Now for 5 minutes to Dr. Ruiz from California for his 5 minutes of questioning.
Thank you. So the esteemed chair had lots to say about making this partisan, but one of the Republican members sent a letter to CDC in a purely partisan fashion. Those responses have not been shared with the minority, and we specifically asked committee staff that responses be shared. And we were told that the letter was the act of an individual member, not the committee. However, today you present a desire to work together and infer that somehow the Democrats are making this political. So,
will the gentleman yield?
Yeah.
Are you referring to the response we got last night?
I'm referring to this letter dated April 5th, 2023.
And the response we received last night? I'm happy to share with you. I was unaware you had not been shared. We'll make sure you get that response.
We'll work with staff to make sure that staff, it's a different letter?
It's a different letter, all right.
So do you want to mention which letter it was?
Oh, okay, I don't know anything about that, so I apologize. But anything that I have, you're more than welcome to have.
Okay.
All right.
Thank you.
And we'll give you some extra time. Oh, you stopped the clock. Okay, good. I didn't want to eat up your time with that. All right, thank you, Dr. Ruiz. Yield back, thank you.
So the suggestion here is that the letter should have been, we should have started with sending an oversight letter from the committee that both Republicans and Democratic committee staff would have access to the responses. And so if you want to do the good oversight together, we're absolutely willing to do that. That's not the approach that the committee and the staff have said that has been taken. So I ask unanimous consent to add the letter dated April 5th, 2023 into the record. Appreciate it. So now, CDC. CDC cannot fulfill its mission to equitably protect Americans from disease and death without a foundation of trust between the agency, healthcare providers, and the public. And during the pandemic, we saw the confusion and damage caused by policymakers promoting fake treatments or undermining scientific evidence, like the importance of masking. There was a lot of conspiratorial accusations that were not founded with any conclusive evidence. These type of misinformation and disinformation and partisan weighing in on, masks and social distancing and whether the virus was a hoax or not is the misinformation and sometimes intentionally disinformation, which I cannot emphasize enough, is not the same as a difference in opinion. This type undermines the efforts of healthcare providers, CDC, and other public health institutions. It manufactures distrust, in fact. The public hears conflicting advice and can become unsure of who to listen to for reliable information. This is a manufactured distrust that harms CDC and other public health entities' ability to be trusted and effective messengers both for physicians who look to them for guidance as well as the general public who now isn't sure who to listen to. Dr. Benjamin, how did we get here? How did early attacks on the integrity of our public health agencies degrade Americans' long-term trust in our institutions?
We had a failure of leadership during the COVID pandemic. We didn't function as a collective at a national level to respond to that emergency. By the way, we still don't do that real well. And I think that we undercommunicated to the American people. We didn't respond quickly to the amount of misinformation and disinformation that was out there. As you know, both of us are emergency docs, so we know how things happen in an emergency, and it's always difficult to address some of these things in an emergency condition. But we've got to do a much better job of partnerships, engagement of people, and addressing the false things that are out there. And I got to tell you, there's a leadership vacuum here that has to be filled, and I am very concerned that I still see it occurring.
I think that there's a misguided prioritization of how to deal with lessons learned in this pandemic. There seems to be a lot of, and I say this wholeheartedly in the concern for our country moving forward. there's a lot of emphasis in trying to prove some intentional, nefarious scheme from Dr. Fauci and Dr. Collins that somehow suppressed information, that the virus was created in a lab and leaked from a lab, and now there's some kind of web of cover-ups. And without any conclusive evidence, with multiple statements from our public health leaders that is not true. And we're missing the opportunity to focus on things that will actually prevent a pandemic and help us prepare for a pandemic. Nobody in the next pandemic is going to be remembering whether or not this alleged accusation is true or not. They're going to want to stay safe, and they're going to want to make sure that we have learned so that we can go through a pandemic resilient and not have to close schools or not have to undergo some of the more extreme measures we had to take because we weren't prepared. And so that's my warning in general, and I'm hoping that we can move from this partisan narrative to more concrete solutions. And with that, I yield back.
Thank you, gentlemen, for yielding back.